Hi everyone, I'm Dr. Hu from China Medical University. Today, we will talk about diagnosis and treatment of DVT. This part includes diagnostic imaging and lab testing, diagnosis, and treatment. At first, diagnostic imaging and lab testing. Venous ultrasound is recommended as first-line imaging method for DVT diagnosis. DVT is diagnosed by the vein being enlarged and non-compressible and absence of flow on color Doppler. He has advantage of non-invasive, portable, and can directly watch the veins and flow. Ultrasound has 97 sensitive specific for symptomatic prismal or popliteal DVT and has 62% of sensitive rate for asymptomatic DVT. CT venography is very useful for detecting DVT in the pelvic cavity. You can see the CTV shows that DVT in the left iliac vein. Phlebography is less used presently. We need further intervention. Venography and digital subtraction is very useful. D-dimer testing has been used in the diagnostic approach to DVT. D-dimer levels are elevated in plasma in the presence of acute DVT because of simultaneous activation of coagulation and fibrolysis. The negative predictive value of D-dimer testing is high, and a normal D-dimer level renders acute PE or DVT unlikely. On the other hand, the positive predictive value of elevated D-dimer level is low, and D-dimer testing is not useful for confirm of PE. So, D-dimer has a high sensitivity but low specificity. Diagnosis. Predictive valve score is very useful for probability assessment of DVT, and the valve score is recommended to stratify patients with suspected lower Lyme DVT. You can see the valve score has different points and calculates the different point. You can stratify the higher suspicion and a likely patient. The essential diagnosis includes symptoms like pain in the calf, thigh, or inguinal region, and swelling, and risk factors include history of recent surgery, trauma, cancer, prolonged immunization, and imaging like venous ultrasound is a useful diagnostic modality of choice. And fibrin degradation products, the D-dimer usually elevated. This slide shows diagnostic and management algorithm from the DVT guidelines of European Society of Cardiology. From the right side, you can see the patient was suspected with DVT. The patient can receive D-dimer testing. If the D-dimer testing negative, renders the patient's DVT unlikely. If the D-dimer positive, he can receive ultrasound, and if the ultrasound confirms the thrombosis in the deep venous system, the diagnosis can be confirmed. Treatment. The therapeutic goals including relieve acute symptoms, prevent extension of thrombosis, and prevent pulmonary embolism, reduce recurrence, restore the patency of venous system, and prevent post-thrombotic symptom. Because DVT forms under low velocity, low shear stress, and hypercoagulation circumstances with activation or coagulation, less dependent on platelet activation. So anticoagulation is the basis for VTE treatment. And many guidelines from different academic society from different countries recommend anticoagulation as a basis for DVT treatment. Based on many guidelines, minimum duration of treatment should maintain at least 3 months. Some VTE patients with cancer or recurrent VTE may need extended treatment, even lifelong treatment. Some patients need vena cava filter to prevent fatal PE. You can see the different kind of filters. Vena cava filter cannot be readily used in the VTE treatment. From the guideline of European Society of Cardiology and ACCP, in the patient with acute DVT or PE who are treated with anticoagulants, we recommend against the use of an IVC filter. And protection indication for IVC filter includes contraindication or complication of anticoagulation, recurrent VTE despite adequate anticoagulation, and chronic recurrent embolism with pulmonary hypertension, and free floating thrombus, and pulmonary prophylaxis before surgery or interventional treatment for the iliofemoral DVT. You can see the thrombus from the retrieved filter. You can see the big thrombus. And we also did surgical thrombectomy for flank major cellular dolens. You can see the very swelling leg with the thrombosis in the incision of the femoral vein. We also treat a patient with post-traumatic PCD. Summary of this part: venous ultrasound is recommended as a first-line imaging method for DVT diagnosis. The D-dimer has high sensitivity for rendering DVT. Anticoagulation is the basis for DVT treatment. Minimum duration of treatment should be 3 months to reduce recurrence. Active interventional treatment should be used for severe iliofemoral DVT. Thank you.